Hello, class. My name is Brittany Lavolpe, and I decided to take the gerontology class. I had a choice between three classes, two of which were very similar to what I do in my job daily. Um, I do case management and group facilitation, and one was principles of group facilitation, and the other one was something regarding addiction, counseling the chemically dependent person. So pretty much in a nutshell, that's what I do day to day with adults. Um, and the population that I mainly work with is like early 20s. So that's what I've done thus far. And the reason why I wanted to take this class was because um, I've always had a really close relationship with my Nana. Um, my mother was really, really, really sick when she had my sister, my younger sister. So my Nana really stepped up and spent a lot of time with me. And through that, we created a very close bond. Um, and because of my relationship with her and the way she is as a person, which you'll be able to learn more when I explain a little bit more a reflection of our interview, she has friends everywhere she goes. She's probably one of the most active women I've ever met at any age, and she's now in her early 70s, so she's always been that way. And the friends that I've met of hers, I've always been close to because, um, I didn't realize that we were so fortunate to be able to spend so much time together, but unfortunately, they don't get to see their grandchildren as much. And she gets to see my 1-year-old a lot too. So, all her friends, even when I was younger, I would always talk to them, sit with them, listen to them. And it gave me somewhat of an admiration to our older population. And then when I started pursuing human services social work, I never really got to work with that population. I'm not saying that kind of what I do, which is a case manager, that there aren't case managers that work with the elderly population, but it just hasn't happened to me yet. So I wanted to more learn about something that I had no experience with rather than learning more of what I already know. So a couple things about the interview that I want to highlight was how active she is. And it reminds me a lot of like a perspective of doing everything activity wise to preserve youth and to preserve your mind. Um, you know, we talked earlier in this class about studies regarding giving older persons responsibilities and activities to do and how healthy it is. My grandmother, this is like her week. She is on the board of her homeowners association. So she has, 1 or 2 meetings a week regarding that. Okay. She also does neighborhood watch. So then that's at night as well to keep the neighborhood that they live in safe. She teaches religious education once a week. She is involved in the theater and costume design, and she was always into like sewing and making things when we were younger. Like she made all me and my sister's clothes, and she made all my mom's clothes. But not until she was older did she really actually get into the costume design portion. She's won awards for costume design in many different theaters that she's worked for. She volunteers at St. Vincent de Paul 3 times a week. She volunteers at the hospital to check people in and, greeting, answering the phone, just because. This is how she stayed balanced. She walks, and she has admitted in the interview that she hasn't done as much lately and how that's kind of made her feel. And a couple times during the course, I did some discussion board comparisons between the way my grandmother has aged versus my grandfather. And she kind of reflected a little bit of her feelings in the interview as well. And it was interesting, that she is aware that him not doing these things, not being involved, kind of somewhat plugging into the television and just ignoring everything and his health failing has had him not age successfully. Um, I think anyone has a lot to learn from my Nana. She's constantly always just lived with integrity, being kind to others, doing for others, being involved. That's the biggest thing. And a couple of months ago, we discussed something because now that she's in her early 70s, not that that's old, it's not, especially with how healthy she is. Um, what are her wishes? Should she be unable to care for herself because her mother is still alive and in late stage dementia and highly, highly, highly confused and, you know, was living with um, one of my Nana's sisters for many years. And then the relief when she was able to go into a home. She actually was one of the people, and what else I learned was she went to the day center. Um, my great grandmother, which is Nana's mom, just to clarify. And they recommended respite after my aunt Kathy had cared for her for many years, who is a registered nurse. And from the day center, she got the respite referral, and then from the respite referral, she got some of referral for like a loophole of long-term care. So learning that, which like we're learning in this class, and then learning that firsthand from someone was extremely fascinating. And actually, now as I give this presentation of our interview, my grandmother is here from the other coast. She flew here because she said it's been getting hard for her to drive here because it's 4 hours away. Um, and just reflections of, you know, the physical health, not being able to do what she used to do, and how she's able to still um, get through this with a positive outlook on everything. And um, just really being able to age successfully and overcome. And I think a general well being of oneself is the absolute key, because that's the biggest um, like game changer I've seen with my grandmother as opposed to other aging adults that maybe aren't in the same situation as her. So that's going to be all from me, and thank you so much for listening, and I look forward to seeing everyone else's feedback too of their interview with an older adult.